Hey guys, Dr. Kyle Loveless here. Today I'm going to talk to you about acid reflux, or many times known as GERD, or even that heartburn that you can often get. I know that if you're someone that deals with that, you're sick and tired of the pain, the discomfort, always worrying about what you have to eat. Anytime you're overstressed, it kind of builds back up. And I know it can be extremely painful. And the good news is, and I've had the opportunity over the last years to work with so many people with acid reflux, and I found that it's actually not as hard as we think to get rid of it. So today I'm going to give you just five simple things that I know if you do these 5 things, your chances of getting rid of acid reflux is going to be very high. Now, everybody's different, so I'm not going to say everybody it's going to work for, but it will help you get healthier. And if these 5 things don't work, I'll tell you what to do instead at the end of the video. So make sure you stay tuned to the whole thing. Also, hey, make sure you hit the like button and subscribe to our channel so that every time we put these new videos out, it comes right back to you. Finally, make sure you go into the comments, leave a comment if you like the video or if there's anything you heard that you might have some advice to add to it. And finally, we have the inflammation ebook that teaches you everything you need to know about inflammation. It gives you 10 things to figure out if you are inflamed. And it's going to give you 10 things you can actually do to reduce the inflammation in your body, which is a huge part of acid reflux and overall digestive health in the first place. All right, guys, let's talk acid reflux or GERD, that heartburn that you get so many times from either over stress or eating certain foods. Some people, it's just a constant issue that they're dealing with. And unfortunately, right now in our world, when you go to a doctor, they're not going to give you a diet. They're not going to give you an eating plan. They're not going to give you things that are actually going to fix the problem. They're going to give you something that's going to lower your stomach acid. Something called a proton pump inhibitor is the most common thing they're going to give you. Mainly, one of the main common ones I'll see is omeprazole. And so I just want to touch on that real quick, because if you're watching this video, you want something more natural, but maybe you haven't gotten there yet. And so omeprazole, I like to talk about proton pump inhibitors because they actually are really bad for you and really hard on your body. They've been linked to things like diabetes. They've been linked to things like kidney disease and kidney problems and liver issues, actually more gut issues, inflammation in the lower GI tract, lowering your magnesium levels, all these things. And I just had this pulled up real quick on my phone. And let me just pull this up because this is from the Mayo Clinic. You can go on the Mayo Clinic's website, put in omeprazole and just learn. Just read the side effects, read the things that it can cause. And it actually says this: if you are on omeprazole for more than 3 months, just 3 months, okay? Now, most of the patients I've coming in, I've seen people on it for 6 years. If you're on omeprazole for more than 3 months, it is possible that the levels of magnesium in your blood may fall. Low levels of magnesium can be seen as fatigue, involuntary muscle contraction, disorientation, convulsions, dizziness, increased heart rate. If you get any of these symptoms, call your doctor. Low levels of magnesium can also lead to a reduction in potassium or calcium levels in the blood. Your doctor may decide to change it up for you. Here's what this means. Low magnesium and low potassium, guess what that is? That causes high blood pressure. So just like any medication, now you're going to slowly get high blood pressure or a heart attack, because it also can lead to a heart attack. Guess what else it does? You got low calcium, low magnesium, low potassium. Now you have weaker bones. So it's also linked to osteoporosis and increased hip fractures and things like that. So it's just a really hardcore medication, and it actually blocks your body's ability to digest. If you read on in that same, article on omeprazole on the Mayo Clinic's website, it also talks about how it can create inflammation in your lower GI tract. Now, let's take a step back. Our whole goal to get rid of acid reflux is to help our digestion, but we're actually hurting it. So here's what you do instead. Instead of taking omeprazole forever, figure out why your stomach acid is coming back up. Okay, and over the last 11 years working with patients, here's what we've come up with on a great protocol for anyone with acid reflux. And if these things don't work, then we start to dive into testing, like stool testing or even food allergy testing, and actually figuring out what's happening in the gut. Is there infections we got to work on, things like that. But if you start with these, I can tell you it's going to make a huge difference for you. So number one, first is I'm going to give you a supplement to start taking, okay? And you've heard of apple cider vinegar before, and that's a good start, but I'm going to ramp it up. If you're someone dealing with acid reflux, if you're trying to get off medications, let's dive right into it and get you on HCl, hydrochloric acid. We're going to increase your stomach acid. I know it seems opposite, but it's actually what's happening is your stomach acid stays so low that your gastric esophageal sphincter isn't closing and the stomach acid comes back up. So I want to get you on apple cider vinegar and hydrochloric acid. There's a great supplement that we use in our office called Digest Well, and we'll have it kind of pictured there for you, but it's from the Wellness Way. It's an awesome, those two combined, you take it once to twice a day and it makes a big difference, okay? So first, apple cider vinegar and HCl. Let's get that stomach acid up. The reason this is so important as well is your stomach acid is what allows you to break down protein, break down fat, break down all the the nutrients and the things that are in our food so that you can actually use them, right? The things your food is made of, it has to break it down so our body can use that. And it also is going to break down viruses and bacteria and all the other microbes that we don't want getting into our lower GI tract causing problems. So your stomach acid is crucial for your overall health, okay? So that's number one, is apple cider vinegar and HCl. Use that supplement, Digest Well. It's awesome. The second thing I'm going to recommend is, it's a bit of a reduction. It is a lifestyle change, okay? If you don't make lifestyle changes, if you keep doing what got you acid reflux, guess what? You're going to keep having acid reflux and more problems down the road. So there is some shifts you have to make. There's never just a supplement. That's just the truth. There's never just a medication. There's never just a supplement. You got to make some changes. And so that first change is we got to reduce the gluten and reduce, so wheat and grains and things like that, reduce that and reduce dairy. Those two things right there are really hard on the digestive system. Gluten is just super hard for our body to break down. It actually creates an immune response in our gut and creates inflammation. And same thing with dairy. Our dairy is super toxic. Just the way the animals are fed, the way the animals are raised, the hormones, everything. And then they take that milk from that really toxic animal. But let's just say it's organic. Okay, let's say that animal is raised well. But they still take that milk and they high heat it. They pasteurize it, right? That pasteurization, the homogenization of that milk actually causes it to be more acidic, number one. And number two, and worse off, is it gets rid of the enzymes that we need to break down that milk. So dairy in our world, unless it's raw dairy, and even at that point, so many people are allergic to it, I would probably just take out dairy if you can. And then the third, so that's number two. The third thing I'm going to recommend was one more final reduction, and that is reduce bad fats, which I'm not going to dive into fully today, but if you want to learn more about what fats are good fats and what fats are bad fats, simply go into the comments. I'll have a link. All you do is click on that link, and it'll take you to a list of good fats versus bad fats, okay? We'll make it simple for you. And because when you're eating these bad toxic fats, they're super inflammatory, number one, and number two, your gallbladder has to break that stuff down. And part of your digestive process is your gallbladder breaking down fats. So you work on crush your gallbladder over time, it gets very sluggish and it can cause problems as well. And then reducing sugar. And we're never going to do a video without saying reducing these refined sugars, right? And things that turn to sugar, because it's inflaming the body and it causes all kinds of other health issues. It feeds yeast, it feeds the bacteria that you don't want in your gut. You just got to reduce the amount of sugar you're eating as well. Okay, so that's three. We got two more, and then I'm going to give you a bonus on what you do if you try these things that don't work. The fourth thing I'm going to tell you is actually a certain specific eating plan for someone that has digestive issues, okay? So if you're someone, you have acid reflux, or maybe you're constipated, whatever that is, we know that you're having trouble breaking down your food properly and getting it through the system. So let's make it easier on your body by giving you foods that are easier to digest. The diet I recommend for that is called the Plant Paradox Diet. Right? Dr. Gunderson wrote an amazing, found an amazing concept that if we get rid of lectin and gluten and all these things that plants naturally have as pesticides, right? Lectin is a natural pesticide that plants use to protect themselves, but is really hard for us to digest, right? I was talking to a patient the other day, and they said, when they're talking about beans, I said, yeah, beans have high in lectin. They're really hard to digest, right? And what's that saying? It's beans, make you smart. How's that go?
Good for your heart.
Good for your heart, yeah. Beans, good for your heart, make you fart, whatever that is. And they came up with that, and I was like, that's exactly why, right? Because it's just so hard to digest. It just sits in our gut and builds up gas, okay? So reducing those foods high in lectin and high in gluten, get the Plant Paradox Diet, start following that as close as possible. That's the next step. And the final step is my favorite of all, and it's the one that I will tell you I've seen the best results with. And I might be a little biased on this, but I've also been doing it for 11 years now, and I've seen enough people come in with acid reflux that have changed their diet, they've taken the supplements, and it's still not gone until we do this one thing, and that's chiropractic care. And the reason that is not because we're some magical adjustment that stops acid reflux. It's because it helps balance your nervous system. And just think about it for a second. When we digest food, our body is made to be, we have two parts of our nervous system. We have our sympathetic and our parasympathetic nervous system. We have fight or flight, and we have relaxed, digest food, sleep, right? So if you're stuck in fight or flight, how well are you going to digest food? Well, you're not. It's going to sit there and it's going to mess up your stomach acid, and you're going to over time get acid reflux. So with chiropractic care, when we adjust the spine, it helps put your body back into that parasympathetic response by balancing out the nervous system. It brings you back into homeostasis. And so with our patients that have had acid reflux, they've tried the other stuff. They come in, we get them adjusted, and it is so awesome how quick that changes, okay? Again, everybody's different. So if you try those 5 things right there, get yourself a good chiropractor that does spinal corrective care that's gonna be take x-rays, they're gonna show you, they're gonna teach you, they're gonna talk to you about how your body's made to work, and then they're gonna actually adjust your spine, not just physical therapy techniques, those are fine, but actually physically adjust your spine and get it moving. That's how I've seen the best result with acid reflux. So those 5 things right there, and I'm telling you, if you do those 5 things, you will see change, and you will be healthier for sure, but you'll also see that change in acid reflux if you don't. And I'm saying if you don't because everybody's different, and people heal differently. They have different stressors in their life that are causing the problem, like acid reflux, because acid reflux is just a symptom of something happening in your gut, right? And so if you've done those 5 things, my final thing, this is kind of the bonus, is you got to get tested. You have to actually do testing so we can tell what is actually happening in your body. You don't know until you look. And there's an awesome test it's called Genova Labs, and it is a stool test. It's a GI test, and will actually GI combination. It does this full comprehensive panel, and it takes 3 stool samples, and it checks everything from parasites to yeast to bacteria. It looks at helps with how pancreatic enzymes are working, how your other digestive enzymes, like from your gallbladder, from your liver, how your body's breaking down food. It also tells us that there's a high amount of immune response, a high inflammatory response happening in the body, and so much more. So that's the next one, is get a stool test, and you can also get a food allergy test along with that plant paradox diet. So you know what foods to take out, follow the plant paradox diet along with that. And guys, that is a recipe for success. And again, everybody's different, so it's about investigating. And I would never shoot a video and say, if everybody does this, they're gonna get better. I'm not Dr. Oz, I don't do that. But I will tell you this, that it will make a big difference for you. So try those things there. And hey, just again, subscribe to our channel, make sure you like this video, and finally go into the comments, get the anti-inflammatory, the non-inflammatory ebook that I wrote and put together. It's about 16 pages long. It gives you a ton of information, gives you 10 ways to figure out if you are inflamed, and 10 things you can actually do about it in your life. You're gonna love it. All right, you guys have an awesome day. We'll talk to you next time. Hey guys, thanks again for watching our videos. If you want to learn more about your health, if you really want to become your own health expert, I want to show you how. We have actually created online courses for you to continue to learn about becoming your own health expert. Our most recent one that we're launching is How Do You Raise a Healthy Family? This one's big. I get questions all the time about this, and I'm going to teach you how to eat. What should your whole family be eating, and how do you individualize that for your family? What supplements should you be taking? How do you detox your family? How do you detox your environment, get these chemicals out? How do you deal with all these things, right? How do you deal with fevers and ear infections and constipation and diarrhea? How do you create a natural medicine cabinet, right? Also, I'm gonna hit on vaccines. I'm gonna talk about the thing that so many people are nervous about but don't know if it's good, don't know if it's bad, don't know what to do. And I'm gonna be very clear and tell you the science behind it all. This is very simple, but hey guys, if you want that, go to the comments, hit the link, and it'll take you to those online courses. You can pick what works best for you and what do you think you wanna learn first. Thanks so much again. You guys have an awesome day.